a daily affair with a lot of confidence and believe that he'll lead a good time, because science is the most powerful tool apart from good lifestyle which can bring them
the best of clinical talent, like the doctors who are sitting on the dais here today. It is possible that we are providing the best in class care. So a certification from the American Heart Association means that we are truly the best in the world, thanks to the entire efforts of the team, the hospital and the entire management as well. This hospital is designated as one of the best hospitals in the world for managing stroke.
State, placing a significant burden of the state's healthcare system. At the same time, Apollo Hospital Health of the Nation 2026 report.
Standards is because of primarily three reasons. Number one, most of American healthcare follows evidence-based care. When we say evidence-based care, we are talking about coming up with newer technology. About how did we get this certification? What are all the efforts that we had to put in the hospital to provide the best in class care? How it will benefit the patients, and how Apollo Hospitals Bangalore is pushing the boundaries in terms of providing the absolute best for everyone.
to be the most ideal care provider for each of the diseases, not for each disease requires a special process and team to come together for that one person throughout the patient's journey. So we have been endeavoring to achieve in every sector of these diseases, and I'm
of asymptomatic individuals who underwent coronary calcium scoring already showed evidence of coronary artery calcification, highlighting how serious heart disease often develops without warning until the emergency occurs.
or discontinuation, then confidence building counseling for the family, how not to get blame the person who suffered a heart attack for his lifestyle, or how you all should not be afraid that something terrible has happened. Yeah, it's an accident, but we'll all work together to prevent another accident and bail him out of the current situation.
Force across the world in identifying the best in class hospitals and recognizing them for the good work that they do. We might ask why someone from America has to come and certify us. Why can't we have something local and get that certification? Isn't it better? Definitely Indian certification.
We all know the traffic in our city. So keeping this in mind, the treatments should start the time the ambulance reaches the patient side and en route throughout the journey. The monitor will be connected to our command center in the emergency department, which
I want to talk about these two certifications. The first one is the Comprehensive Chest Pain Center, meaning that this hospital is certified as providing the best in class care for people with chest pain. The second certification is the Comprehensive Stroke Center.
this backdrop, the dual certification follows an independent evaluation of the hospital preparedness to manage patients with suspected stroke and acute heart attack, from arrival up to the emergency department through diagnosis, interventions, and critical care and continuity of the care till the discharge. In both stroke and acute heart attack, training to the community, which is also benefiting. It's not only the medical support has to come immediately. The public can recognize the early warning signs of stroke and early warning signs of chest pain. So we started training the symptoms of any patient comes with the chest pain and heart attack, and same with the stroke of PFAS symptoms, which our consultants will also continue with us. So here it is making 69 years of age. As the burden of these conditions continues to rise, improving hospital preparedness and reducing the time taken to diagnose and treat patients have become critical on improving survival. In Karnataka alone, we have around 5 lakh stroke.
The key reasons. The second one is their established infrastructure. They are able to provide the best in class care because of the highest end infrastructure, and India, even though we might not have the latest and greatest in terms of technology, but we are definitely catching up. Apollo Hospitals especially has invested heavily in infrastructure and made sure that we provide the best to the patients at every.
We are very proud and honored to come forward you and announce that we are the first center in the country to be certified today for joint stroke and acute chest pain management as the gold standard that can be provided anywhere in the world. As our CEO just put it across to you, why is this AHA certification is a testament to excellence in healthcare delivery to the most vulnerable patient who is having an ongoing heart attack which can kill him, or an ongoing paralysis, the stroke where the brain is dying every minute. How do you prevent further death and bring back the partial injury that has happened, and don't wait for more irreversible damage to happen? Our unwavering endeavor that has gone into creating infrastructure in terms of technology, people skill, thirdly putting in that processes in place from the time a patient comes in contact with the security man to the emergency nurse, doctor, then the activate American Heart Association. So why do we take this pride? Because we like to set the standard of care for everybody else. We push ourselves continuously to provide our own people and community the best that humans can get on the planet with an effort of a cohesive team at Apollo, that is their leadership, owners, the doctors, including the security person, the nurse, the rehab team. Everybody endeavors to give the best chance for this most vulnerable patient. So it gives a matter of great joy for all of us to share with you and tell the community that this is one group of hospital which has made excellence as a benchmark, and this is being validated and recognized by the highest authority who puts the ideal care. There's an ideal father, ideal husband, ideal son. It is an idea for most of them, but there are few people. In the same fashion, there are ideal hospital. There are very few, and we start that journey every